Hello, so today our objectives, by the end of this video you can be able to say what the difference is between a soft tissue and hard tissue injury, describe a fracture, and I've added in dislocation and concussion as well. And these are injuries that we are going to be targeting within the lesson in a practical way, and also I want you to be able to recall what SALTAPS and PRICED means. So our first one is types of injury. So we can look at our hard tissue injuries. Now, pretty much what it says on the tin. If you can feel a hard bit in your body and that gets injured, then that's the kind of thing. So if a bone breaks, you can feel a bone, it's hard, it breaks, it's a fracture. If your shoulder pops out of its socket, that's a dislocation. And then we have things like stress fractures from overuse, where if you overuse, for example, if you overuse your ankle, you might then start to see, or your foot, you might see fractures in your heel. Shin splints is then pain of the tibia coming through from overuse. And soft tissue, this word comes in through all the soft squidgy stuff, so coming from muscles that you can poke, to ligaments, tendons, even blood. And if we have a look here, hema. Heme comes from ancient Greek for meaning blood. If we just zoom out there. I have abrasions of the skin. Our sprain is our ligament, strains muscles and tendons. Concussion, so that's affecting that big squidgy thing between your ears, which is your brain. Tendinitis, referring to tendons. Blister, that's once again with the skin. Cartilage, that soft spongy stuff that we find in our joints. Okay, so I think you get the gist of what the difference is between hard are things that you can feel, that are pointy, that can then break and get hurt, and the soft things are all the squidgy, liquid, spongy kind of items in our body, such as brain, blood, skin, muscle, and ligaments. Moving on. So, we're going to decide what a fracture is. Now we have this definition here. A fracture is a break, crack, flake or chip in the bone. And we can see here on our diagram, right down here. So we have a very obvious break there. And if we zoom in, we can see that we have not only a fracture of the bone, but it's also chipped away as well. So that's a very, very severe fracture. And in this one here, we have our fracture coming right about there, and it looks like there might also be one there as well. So we have our fibula. This looks like it comes from the ankle, so we have our fibula at the back, which is this one, and then a fracture of the tibia as well, so a double fracture, not good. Right, now signs and symptoms. So you might have actually heard a crack. We may have heard of things going, but you can actually hear a crack. When I broke my fibula, it was actually a positive crack that was very audible even for people around me. It was very painful. You couldn't actually see it sticking out, but you may see that if you have what it says here, a bone protruding from the skin. That's also known as an open fracture, and there's a big risk of infection if that happens. So when it comes down to it, that has to be disinfected and covered up. Localized swelling and bruising, pretty much with most injuries, and very obvious common sense here. They will be unwilling or unable to move or put weight on it. So this will link into SALTAPS, as one of SALTAPS is asking the person, can they move it? So if they're unwilling to, then it's a very good chance that it may be fractured. Okay, moving on. Treatment of a fracture, very straightforward. Not going to move him. Immobilize. Now this is where you might have your guy wearing a sling. So this is an example of an arm. Great diagram here. And this goes around the shoulder. And this bit here, this is our sling. And you may do this for if a person had fractured their elbow. With any fracture, you want to call 999 for help. Now the person may be getting cold due to what's called shock. So this is where you have vasoconstriction, and so blood wants to stay around the core organs within the body. So if we have our guy here, the blood is only going to be sort of around the head and around the internal organs. Now I have to excuse his massive arm, left arm, but all the blood is going to come out of the limbs and be centered around those internal organs, keeping them warm. Because there's been a massive shock, a big injury, a fracture, the body goes into a defense mechanism, keeps everything. So then the person is then going to be getting cold, perhaps in their extremities, and might then be getting hypothermia. So you want to keep them warm, put a jacket over them, but without making them move too much. And then you want to look after them and make sure they're okay. Okay, dislocation. Abnormal separation of bones at a joint. So there might not be a fracture, however, but the bones have come out of their normal joint and aren't sitting properly. If we have a look here on our x-ray, we can clearly see that this little finger, very prone for goalkeepers, that the finger is not where it should be. So we have the phalange and we have the metacarpal are not sitting right, and there's very clearly going to be some ligament damage as well. As we know, ligaments hold bones to bones. So we look at our symptoms here. We have intense pain, obviously, dislocated something, but the joint instability is when, because that's come out, there's going to be ligament damage, because those ligaments are very good at holding the bones in place. But there's a big enough force to take those bones out of place, then those ligaments are going to be damaged. And then we see our deformity, like our finger was in the wrong place. Obviously, if it's out of its socket, you're not going to be able to generate any force through it, so there'll be no muscle strength. And as always, bruising, redness, and linked to intense pain, you're going to have difficulty moving it, but that's very common sense. What do we do? So dislocation, if you're not a trained medical professional, don't try to do anything with it. Refer them on, get an ambulance, or take them to the hospital, where they will then x-ray to make sure that it is actually a dislocation. They will then manipulate it back in. So popping it back into place is the term that is used. And however, if it's dislocated for a long time, you may then see blood supply to the joint may be stopped. Now, because of how the blood vessels travel to the ankle, a dislocation may prevent blood getting to the ankle and the foot, which then can be very bad, as the tissues need the oxygen to respire, and if they don't get that, then the tissue itself can then start to die, which you don't want. So therefore, it's got to be manipulated or popped back into position as soon as possible. Concussion. So this is pretty much a trauma to the head. So we have our guy here. Here's his head. Here's his brain. Now you can see here that there is space between the brain and the skull. So if you get a whack onto the side of the head, that brain is going to rattle around left or right. And from that, bad things can happen. If the brain gets damaged, you can notice things such as a headache. Obviously, the brain's been hurt. Or this is actually more to do with how the brain interprets all the different things that are going on. So it may be that your vision goes, or you feel like you're in a fog, and then this will contribute to your headache, because the brain doesn't actually have any nerve endings and can't feel pain. The person might be knocked out for a short time and then come back round, or may be very forgetful after and not even remember it. Behavioural changes, they might get really annoyed really quickly, more than usual, and cognitive impairment, so they might have slowed reaction time. So they might take be a little bit sluggish or a little bit slow after taking a hit to the head. Once again, sounds like that's common sense. Okay, so getting on to SALTAPS now. So with first aid, you've got to think about one of the last injuries you have. What did you see? Was it safe to approach and go and help? Were there other things going on around? Could you easily tell what had happened to the person? Could you diagnose their injury? And how did that injured person respond when you were trying to talk to them? So let's see what we with that. So we use a thing called SALTAPS. Now the first thing we do is, if a player gets injured, we stop what we're doing. Very straightforward. If it's in the middle of a game, player breaks their leg, we don't want to keep on playing around them. Next, we're going to ask them, how do you feel? What do you think might have happened? So that's our next one. We're going to ask them what's going on. So we can then, if they say this is the worst pain I've ever felt in my life, you know that it could be quite severe. Right, now we're going to look. If there is a bone sticking out of their leg, we know that it is an open fracture, as talking before. Or if there's a deformity. For example, if their finger is going the wrong way, we know that would be dislocated. Also, we can look for bleeding or swelling. So we've done our look there. Looking on to touch. So now this is only if really the player allows it. We have it here. So if it's not too serious and the player doesn't mind, you have to talk them through it and say you're just going to touch to see how it feels. If they allow you and then you touch something and it hurts, you then may have a good idea about where their injury is and what it actually is. Okay. So if we've gone through that, we can then ask them, can you move it? If they can move it, we know from before that means it is not a fracture. It could be a very hairline or a small one, but it's not a full-on fracture. So, if they can move it a little bit, but not with a full range of movement, we know that there is an injury there. The next bit is passively move the area. So, can you, as the first aider, then actually move the affected area yourself? For example, if a person's complaining of elbow pain and you gently lift their hand up, so here's the elbow with their hand, and you just help move that arm up, you can then look to see if there's any pain there. And then if that's doing, you can do a bit more of a strength test, and then you could perhaps push down onto that arm and say, right, can you pull up against me if it's not in too much pain and they think they might be able to try it. And that essentially is SALTAPS. Stop, ask, look, touch. Active, can they move it? Passive, can you can you move it yourself? And strength, do you have your original strength that you had before you had the injury? So moving on is for a few injuries, and for example a strain or a sprain, and we have protect. So you want to protect that injury, make sure they don't do any more. If you followed SALTAPS and you stop them, that's one way of preventing further injury or making things worse. You want them to get to rest it, so don't put too much weight on it. Perhaps they don't continue to play, so then healing can begin. You then apply ice. So this reduces inflammation, which to start with is a good thing, inflammation. However, it can cause pain and discomfort and not be too beneficial to the person, so it's no longer needed. So using ice will reduce that. Also, compressing the area using a bandage or a tuber grip can reduce that swelling that can be causing pain. Elevation. Elevate the injured area, and so if we put our leg up, here's our leg, and he's got an injured ankle, then that swelling and tissue fluid is going to drain out of that affected area and reduce the swelling. And the D stands for diagnosis by a professional. Go get the doctor or physio to then say what the injury actually is, so then proper treatment can be given. And that concludes our video. So I will see you in class. You need to know difference between soft tissue and a hard tissue, examples of fractures, dislocations and concussions, and what SALTAPS and PRICED mean. So I will see you in lesson. Goodbye.